Good evening, everyone. As you all beloved fellows know, we decided that we'll be revising Axilla today. So let me share the screen and we'll be discussing Axilla. First of all, as you could see, it's this area. You could see it's the shaded area, which is called the pyramid, which is called the Axilla. I'm sorry. It's the shaded area, which is called the axilla, and it's the pyramid shaped or diamond shaped, people can say. Pyramid shaped or diamond shaped. It has 4 walls, as you could see, the interior wall. This one, I can maybe show you. Wait, in another clear image that what you have to look at, right? This one. Right, so the interior wall of the axilla, they say it's 2-layered, superficial and deep. And if you look at superficial, so this is first layer, pectoralis major muscle, while the deep layer includes, if it's major, there has to be a minor, pectoralis minor muscle and subclavius, and the clavipectoral fascia, which encloses these 2 muscles. So this is pectoralis minor muscle, you could see, and clavipectoralis fascia would be there. So this is the second layer, and this is the superficial layer, this is the deeper layer of the anterior wall of the axilla. If we are coming back to the posterior wall, so they say it is considerably longer, and you can see, trying to enlarge it, so you could probably see subscapularis and teres major and latissimus dorsi, which form the, this is latissimus dorsi muscle. See this one, subscapularis. This is, if this is upper subscapular nerve, so this muscle would be the subscapular muscle, yeah, subscapularis muscle. And then the third one is teres major. This is teres major muscle. As you could see here, it's showing both sides. You could see according to the netters, this is the axilla, posterior wall, and the cords of the brachial plexus and the posterior wall. But some part of the interior wall is also there. And if you have to look at the medial wall, so if it's medial, so this is the center, so that would be medial wall here, as we showed. So all the upper four intercostal muscles, these are the, this is the serratus anterior, but here would be the intercostal muscles. So first four upper 4 intercostal spaces covered by the serratus anterior, digitoris. See, this is serratus anterior. And lateral wall is the medial aspect of the upper part of the arm. So this is the lateral wall, right? And if you could look at the base of the axilla, so its base is here. So base of the axillary pyramid, it's deep fascia, which stretches over the lateral aspect of the chest wall. And it's called the axillary fascia, as you could say, because it has its lower attachment to the pectoralis major and latissimus dorsi muscle. Basically, if you look at the axilla of the apex of the axilla, so it's truncated, and it's basically the gap between the middle third. If you could look here, the clavicle, the middle third, and the outer edge of the first rib. I couldn't find any better image to show you people, but if we could see any of the, yeah, this is the clavicle. So the apex of the axilla is basically, you have to imagine it, it's truncated and it's located between the gap of the middle third of the clavicle and the outer edge of the first rib, right? This gap is also known as the cervicoaxillary opening, and this opening, cervicoaxillary opening, transmits subclavian artery and the brachial plexus. So this is subclavian artery and the brachial plexus, which are transmitted from the opening of the axilla or cervicoaxillary opening. Also, it includes the axillary vein from the axilla into the neck, and this cervicoaxillary opening is also traversed by the numerous lymphatic channels, of course. So basically, I've already given you away the contents of the axilla. It's the axillary artery, as you know, and its branches, the axillary vein and its tributaries, cords of the brachial plexus, see, and their branches, of course, axillary lymph nodes and the intercostobrachial nerves, right? Even the intercostobrachial nerves traverses through this cervicoaxillary opening, or you can say they're the contents of the axilla. And all of these structures are contained in the axillary fat, which is usually quite substantial points in the axilla. Right. So this is it for today. One more thing I maybe forgot that they say, this axilla is a transition between the neck and the upper limb. And I already told you it's the diamond shaped or the pyramid shaped. Kind of showed you approximate image. So for next revision, kindly go through brachial plexus and we'll revise brachial plexus tomorrow. After that, we'll revise the course of axillary vessels. Yeah, and that kind of would cover the axilla. Right, thank you so much. Bye-bye.